Sunscreens might mess with your hormones. And no, I'm not exaggerating. Hi, I'm Dr. Mike, a board-certified medical doctor. And today we're breaking down what sunscreens really do, why some filters end up in your bloodstream, and whether your SPF habit is protecting you or messing you up, and my personal recommendation for which sunscreen brands you should actually be using. We live on a rock called Earth, flying through space, orbiting a giant fusion reactor, the Sun, that bathes us all in all sorts of radiation. Among them, UVA and UVB, two forms of ultraviolet light. Let's talk briefly about these two. UVB is the more infamous one. It doesn't penetrate very deeply, but it's the reason you look like a cooked lobster after one careless day at the beach. And more important, it causes direct mutations in your DNA, your genetic blueprint. UVA, on the other hand, flies a little bit under the radar, but it's just as dangerous. It penetrates deeper into the skin, down into the dermis where your collagen and elastin lives. It doesn't give you sunburn, which makes it sneakier, but it breaks down collagen, causes loss of elasticity, and accelerates wrinkling and sagging. And if that wasn't enough, UVA generates free radicals, which are unstable molecules that damage your DNA indirectly, setting off a chain reaction of inflammation, aging, and also cancer. So what happens when you expose yourself to sunlight? Your sun produces more melanin, you get a tan, which acts like a weak sunscreen. If you had to put it into numbers, it's around SPF 5 to 7. This natural sunscreen protects your cell's nuclei, the place where your DNA is stored, from the damaging rays. So tanning does protect you a bit from cancer. That's why the rate of basal cell carcinoma, which is a type of skin cancer caused by sun exposure, is lower in Italy, where people tend to be more tanned, compared to Australia, where people are descendants of pale Brits who burn just by looking at a picture of a sun. I guess evolution needs another million years to make Australians more sun resistant. No hate, very friendly people.
Oh no, the condensation! Emma!
Anyway, back to the topic. We talked about SPF, sun protection factor. This measures how much longer it takes for your skin to burn with sunscreen compared to without. That number is obviously different for everybody. For Ed Sheeran, it's probably a negative 100. It also depends on things like the UV index on a given day, altitude and surroundings. Snow, sand and water all reflect UV and crank it up. So SPF 30 means in theory you can stay out in the sun 30 times longer before turning red. A fair-skinned person might burn in 10 minutes at noon. Someone with a darker complexion might last 30 minutes or more. So SPF isn't a fixed time. It's a multiplier of your personal burn threshold. But here's the catch. That only applies in lab conditions. No sweat, no rubbing, no missed spots. Basically, sunscreen applied by a German aerospace engineer in a windless vacuum. How do sunscreens work? In simple terms, they either absorb the UV rays or they block them before they can mess with your DNA. There are chemical sunscreens, which are the majority of sunscreens nowadays because they have a lot of advantages. These act like little sponges. They absorb UVA or UVB radiation, convert it into heat and release it. They are invincible and work pretty well if regularly applied. Mineral sunscreens use ingredients like zinc oxide or titanium dioxide. They sit on your skin like microscopic disco balls and reflect the rays like a mirror. The disadvantage is that some of them make you look like Casper the Ghost. There are some formulations with nanoparticles where the titanium or zinc oxide is put into very small pieces that intend to reduce this white cast. Either way, the mission is the same. Prevent the UV rays from penetrating your skin, protecting your DNA, and keep your collagen from jumping off a cliff. As a trained cancer doctor, I unfortunately have to confirm, yes. There's a clear association between sunburns, not sun exposure, very important distinction, and 3 types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. There's been more than enough solid evidence over the past few decades to firmly establish this link. If you don't believe that, that's fine. There are also people who believe in lizard people or that the earth is flat and surrounded by a giant wall of ice. I've had enough patients in my practice with squamous cell carcinoma growing on their ears, scalp and temples, Bright red, bleeding, crusty like a cauliflower from hell. And what do they have in common? They spent decades working or walking outdoors, no sunscreen, repeated sunburns. Some even told me they were very proud about their sunburns. Oh well. Now, you might wonder, if sunscreen works, why are skin cancer rates still rising? Good question. And the answer is not as easy, but there are some theories. First, people forget to reapply sunscreen. Even when the label says water resistant, don't be fooled. Spend 20 minutes swimming or most of that protection is washed away. Or if you're like me and there's no breeze on the beach and you're sweating like a pig, that sweat carries the sunscreen right off. Or you dive for the volleyball and slide across the sand. Half of it is gone. As you can see, it's actually surprisingly difficult to keep an effective layer of sunscreen on your skin for more than 2 hours. And then there's human behavior. I'll be honest, I forget to reapply or half-ass it. A quick smear there, a missed spot there, and suddenly you're getting full UV exposure on your shoulders while thinking you're protected. I remember when I was in Southern California last time and I was wearing shorts and didn't apply sunscreen high enough up my thighs because I thought my swimming trunks would cover it. Bad mistake. I had such a bad sunburn in my upper thigh that left a pigmentation spot for like 6 months. The second theory on rising skin cancer rates is that sunscreens give a false sense of security. You apply SPF 50 at noon once, you think you're safe and stay out the whole day. And now to the third, deeper reason, pun intended. For a long time, many sunscreens only protected well against UVB, the rays that cause sunburn. But what they didn't do is they didn't protect you much against UVA, which penetrates deeper and is just as carcinogenic. So people who used sunscreens didn't get burned and thought they were safe, while UVA rays were silently generating free radicals in the dermis, aging their collagen and mutating their skin cell one photon at a time. Before we continue on the potential harmful effects of sunscreen on the body, I want to state, even the cheapest sunscreen you bought, full of chemicals and things your body does not like, is better than going out with no sunscreen if you know that you are at risk of getting a sunburn. You want to avoid a sunburn at all costs. Now, there's been a lot of controversy about chemical sunscreens, and to be clear, I mean only chemical ones. Mineral sunscreens, the ones that contain little disco balls to reflect the sunlight, are safe in this regard. The real issue lies with chemical filters, and one of the most infamous one is Oxybenzone, also known as the ingredient benzophenone 3. Oxybenzone is, however, very effective in doing what it's supposed to do. But Oxybenzone has been shown in several lab and animal studies that it acts as a hormone disruptor. It can bind to estrogen receptors, mimic hormonal activity, and interfere with the normal endocrine system. There's also evidence that it can lower testosterone levels, alter thyroid function, and even affect reproductive development, at least in animal models. And yes, it's been detected in human urine, breast milk, and amniotic fluid. So it's not just sitting on your skin and vanishing into the ether, it's getting into your system. The American Academy of Pediatrics even recommended avoiding oxybenzone in children due to these concerns. So what are real-world clinical consequences? The truth is we just don't know. And here's the problem. We can't isolate the long-term effects of oxybenzone from everything else that influences our health, like what we eat, how much we move, the air we breathe, or the medications we take. Now let's get practical. I picked out some sunscreens from the Walmart's homepage. Surprisingly, many didn't contain oxybenzone, but the replacement lineup isn't just exactly cutting edge either. Instead, the active ingredients Avobenzone, homosalate, octisalate, and octocrylene all are used in similar concentrations. Are these better than oxybenzone? Slightly. These are all older generation filters from the 90s. While Europe, Asia, and Australia have moved to next generation UV filters with better safety and stability profiles, the US is still stuck with these due to outdated FDA regulations. What's the issue? These 4 ingredients are small molecules. They can penetrate the skin and enter the bloodstream. In the case of octocrylene, it gets even worse. It can degrade over time, even at room temperature, into benzophenone, a possible human carcinogen with known hormonal effects in animal studies. It's also reef toxic and harmful to marine ecosystems. So get rid of any old sunscreens you still have at home. A 2020 study tested how much sunscreen gets absorbed into the body under normal use. The answer? A lot more than we thought. Avobenzone, Octocrylene and Oxybenzone all exceeded the FDA safety threshold of 0.5 nanograms per milliliter, with Oxybenzone peaking at a staggering 258 nanograms per milliliter in your blood. That's 516 times above the threshold. No immediate side effects were found, but the ingredient stayed in the bloodstream for days, and the long-term impact of that kind of exposure is still unknown. So what's the solution? If you're watching this video from Europe, Asia, or basically anywhere outside the US, you have access to better options. I used to use La Roche-Posay's Antelios invisible fluid, which is elegantly formulated but still contains avobenzone. These days I switched to Beauty of Joseon, or however pronounce that. A Korean sunscreen that uses modern UV filters like Tinosorb M and UV Null A+. This is my personal recommendation, no affiliation here. These filters are large molecules, meaning they sit on the skin rather than soaking into your bloodstream. And they're photostable and most importantly, not hormone disrupting. Unfortunately, these newer filters aren't available in the US. Why? Because sunscreens are regulated as over-the-counter drugs there. That means that new UV filters have to go through the same expensive FDA approval process as pharmaceuticals. So most brands stick to what's already approved, even if it's outdated. So what should you do if you live in the US? If you can't get your hands on a Korean or European sunscreen, I could recommend switching to a mineral sunscreen. They've come a long way. The white cast is minimal in newer formulas. One I can wholeheartedly recommend is Elta MD UV Daily. It uses a zinc oxide, which is a broad spectrum, doesn't enter the bloodstream, and is reef safe. It also contains niacinamide and tocopherol, which strengthen your skin barrier and fights free radicals. Yes, it contains a few preservatives that might irritate ultra-sensitive skin, but overall it's one of the best you can get in the US. Why don't I use it? Simply because I live in Europe and here I have access to modern filters that are just as safe and easier to use. Now, before you get discouraged, yes, this topic seems simple at first, but the deeper you go, the messier it gets. Still, if all you've got at home is a basic drugstore sunscreen and you're heading to the beach after this video, please use it. I'd rather have a little avobenzone in your bloodstream than a nasty sunburn. Trust me, the sunburn is worse. Am I saying avoid the sun at all costs? Not at all. People who spend more time outdoors are generally healthier than those glued to the couch. As always, moderation is key. So guys, your skin is more important than the paint job on your car. And yet I know some of you own more detailing products for your ride than skincare for your face and body. Time to rethink that, because you cannot get a lease on a new body. Drop your questions below, and until the next time, bye bye.